Alright, so in this video, I'm going to talk a little bit about major depressive disorder, specifically in the setting of child or adolescent psychiatry. So obviously, children, adolescents can end up with major depressive disorder just like adults can, but there are a few nuance points and a few differences that you should be aware of. So MDD can present with either sad or irritable mood. So the classic exam question that blows one up right there is that they'll say most of the time children and adolescents will present primarily with irritable mood versus sad mood or depressed mood. So, but very, very similar in many ways to the adults. Obviously, one of the two big criteria that they must have for a 2 week period of time is they must have either depressed mood or anhedonia, which I have listed here as loss of interest in pleasurable activities. So same for children, they have to have a sad, irritable mood and or a loss of interest in pleasurable activities. But look out specifically for that irritable mood part component to be in the vignette somewhere. Child-specific difficulties with MDD include school difficulties, so if the child's having difficulties in school, if they're refusing to go to school, and if they have a lot of somatic complaints, abdominal pain, headaches, etc., and aggressive antisocial behavioral patterns. Psychological changes such as weight change and sleep pattern disruption might also be present. So just like in adults, we know that sometimes they could either gain weight or lose weight. The more common is probably weight loss due to not eating properly, and obviously sleep pattern changes. But remember, children have a slightly different sleep pattern anyway. They tend to need a little bit more sleep than adults, and they tend to sleep a little bit longer in the morning and don't like to usually wake up as early. So watch out for that, but look for sleep pattern changes as well. Difficulty initiating sleep, difficulty remaining asleep, frequent nighttime awakenings, that kind of stuff. And psychotic symptoms might be present in a depressed child as well, so you got to be on the lookout for MDD with psychotic features, just like you would have in your adult population. So really not too much different there. The main thing I'll point out is look for that irritable mood in those questions, because it will come up. So the prevalence of MDD, not as prevalent as adults, but it's about 0.5% in preschoolers, 1% to 2% for school-age children, and 3.5 to 11% for adolescents. So in my opinion, this makes perfect sense, right? Because obviously preschoolers, they're not really going to have a lot of depression unless the family life is really messed up, in which case that could be true. But for the most part, obviously preschoolers are not going to have as many issues with depression. The 1 to 2% school-age children, well, I think when you're younger things are a little bit easier, but really when you start to see the depression is when you get into that 3.5 to 11% in adolescence. And that's because adolescence is a difficult time, I'd say, for just about everybody who goes through it, and everybody does have their period where they obviously have to go through adolescence. And that's a time where there's a lot of competition, there's a lot of pressure, and there's a lot going on that I think makes perfect sense why these kids would become more depressed at that time. Obviously, females are experiencing it at 1.5 to 3-fold higher rates of depression than males beginning in early adolescence. So beginning in early adolescence, we start to see that not only an increase in the prevalence overall of MDD, but we also start to see that there's an increase 1.5 to 3-fold higher rate in women. As far as the treatment goes, pharmacological management uses the same medications as adults for the most part of the antidepressants. Fluoxetine and escitalopram or Lexapro, so fluoxetine is Prozac, escitalopram is Lexapro, are the FDA approved for the use in adolescents. Fluoxetine is approved for children over 8 years old, and escitalopram is approved for children 12 years and above. The other SSRIs are also widely used but not FDA approved. So sometimes a common testable point is what are the FDA approved drugs for a particular population? So you're going to want to remember that there's really only 2 actual FDA approved drugs, and even when you're in clinical practice, especially early on in your training and early on in your clinical practice, you're going to want to use more of the FDA approved and less of the off-label uses of medications, because again, it shows that you're working within the parameters of research-based and evidence-based science. So you're saying, the FDA has looked at these medications and they've determined that Prozac or fluoxetine is appropriate for children over 8 and escitalopram for children over 12. But the other ones probably have, again, similar efficacy and may be used in certain settings. Like I know sertraline and Luvox are also, or fluvoxamine, are used a lot in OCD cases. And clearly in adolescence, you could start to see OCD cases and things like that as well. So just some thoughts on major depressive disorder. Not very much different than adults, but the bottom line is look for that irritable mood. Remember some of these statistical things like the prevalence in school-age children, and remember the prevalence is pretty high in adolescents, it's higher in females, kind of stuff we already know. And probably the most important points is the pharmacological management, indicating that there's really only 2 FDA-approved medications for MDD in children.